I'm running for U.S. Congress to represent our district in Minnesota, 7th District. And when it comes to healthcare, I believe we have the best healthcare system in the world. And we need to look at how to improve that, discussing with doctors and nurses and the whole medical profession, and give choice back to us, we the people. So having said all of that, and before we start talking about Obama healthcare and the mandates and the requirements of government taking over our best system in the world, enlighten us, bring us up to speed on you went through these 10 heart operations. How did the American healthcare system work for you, the strength of what we have?
Yeah, well, the short answer is I'm alive. It worked. It worked miracles. In 1980, when I was born, there were hardly any options. There were no surgeries to do after my second operation. They said, we've exhausted our research. But that whole time, they pressed on, and they continued to innovate and to be cutting edge and always pushing forward. And every time I needed a breakthrough, we got it. I mean, I wasn't raised in a wealthy family. We were a middle-class family. My dad was a police officer, and my mom was a stay-at-home mom, and it was 3 of us boys, in a suburb of Minneapolis up here in Elk River. My dad had health insurance through the city for being a police officer, and yeah, we had to switch health insurance companies a lot because they'd get stuck with a big bill and they'd drop our group and we'd find a different one. But so did a lot of other people, and a lot of other people adapted to that. Now, are there ways to streamline that process and improve that health insurance industry in the state of Minnesota and in our country? Yeah, absolutely there is. Is the answer to demolish the system, to take that high level of excellent quality care that people, we have sheiks and Saudi princes that fly to Minnesota,
to Mayo Clinic,
to the Mayo Clinic for health care. I don't see a big line of planes going to European nationalized healthcare systems for the world's rich and famous to get treated, because they don't have the innovation, the ingenuity, and the standard of care that we have here. And trust me, Lee, when we take these expectations and we take that down and we settle for mediocrity across the board, the sad thing is, and it's a sad state to even talk about, but the closest thing we have in our nation to socialized health care is our veteran system. And you look at our VA clinics and our VA hospitals around the world, around the country, where our vets make appointments.
Yeah, and that's the direction the current administration is trying to go.
Absolutely. Yeah. You have a vet now that makes an appointment and waits 3-6 months or weeks or however long to get a call back to get their appointment scheduled, get in there, and that is not the direction. That's an atrocity that needs to be addressed, and that needs to be privatized.
Right.
But Obamacare is going the exact opposite direction. They're trying to take and standardize and lower our expectations and the quality of our health care by nationalizing it. There's no economic model on the planet that says if you want things to operate better, more efficient, and more effectively, you make it top-heavy and bigger.
So would you agree that the right idea is first to repeal Obama healthcare and then start over building on the strength of what we have, and then look for improvements, more competition, more choice for customers, and continue building on the goodness of the system we have? Yeah. Now, you also happen to be a spokesperson for the American Heart Association. Tell us how that came about and what your role has been in that segment.
Yeah, so I think you're right. I think we need to repeal it. Repeal it now, immediately. Anyone that does not stand before America as a United States congressman or United States senator and say that they will vote to repeal health care, that's a shame. Mm-hmm. That's an absolute shame. It needs to be repealed, to pass a bill that they don't know what's in.
That's right. Yeah.
And to pass the bill to find out what's in it. It's a shame. Now, my work volunteering for the Heart Association is really, it's separate from the social policy stuff, but it's really about talking about innovation and ingenuity. I'm a firm believer in investing in healthcare and investing in research. I wouldn't be alive today if it wasn't for that. Mm-hmm. So I started speaking for the American Heart Association when I was a 14-year-old boy. I had an opportunity to speak down in Minneapolis, and then pretty soon there was a group in Sioux Falls that wanted me to go out there and speak, and then pretty soon I was out in Rapid City because someone out there wanted to speak. And I've been very blessed through the Heart Association and had an opportunity to travel around the country speaking on behalf of the American Heart Association and raising money for the Heart Association to do exactly what our current healthcare system allows us to do, which is continuously push the envelope, continuously innovate.
Right.
When we get to a model that's standardized and nationalized, and we're looking for what we're trying to put everyone, every square peg in that round hole, no matter what. Mm-hmm. Well, that doesn't work, Lee. My body's different than yours. Mm-hmm. My healthcare needs are different than yours. And when you look at trying to create a system for hundreds of millions of Americans and expect that one system is going to cover everyone the same, that's not the answer. It doesn't work. It's basic math. That's a failing proposition.
Mm-hmm. So, I mean, it really goes back to also the idea that in America versus Europe, what we developed here was influenced by the fact that we value life more than in most other nations. Mm-hmm. So our healthcare system, a segment of it will be costlier because we value life to the point that we will invest in premature birth for the early part of life, and we do the same thing with the population as we age. We invest in life, and the price of that is a little higher cost than other nations. But that's a choice we have made as a nation because life is important.
America as a society, as a culture, in my belief, are optimistic people. We're dreamers. We believe. We believe that tomorrow is going to be better than yesterday. And I'll never forget, I was 15 years old at Abbott Northwestern Hospital. I was waiting for the heart transplant. I waited for 2 years. I waited 6 months inpatient at Abbott. And one day the doctors came in and they said, "Nick, we're not going to find a heart transplant for you. There's nothing else we can do."
Tell me again, how old were you?
I was 15.
You were 15.
They said, "There's nothing we can do. We're not going to be able to find a heart that we can get to match and fit." And so they said, "Go home. Spend the next 6 months that you have left with your family and make that time count." I was home for 1 month when the doctors called back and said, "You know what? We've been just doing nothing but thinking about this, and we've got an idea. We're going to go in and we're going to open you up. We're going to take that failing right side of your heart, and we're going to reconstruct it with a pericardium from a cow's heart." And they said, "We don't know if this will work." They said, "We don't know if this will work. We've never tried it before. Wow. But we're willing to try it because we think there's a chance. Right. We have hope." Yeah. Now, under a standardized, nationalized, mediocrity for all healthcare system,
you kill that creativity.
You kill that creativity. Right. You kill that ability to constantly push the envelope. Yeah. There's a predetermined, federally approved protocol. Right. And you either follow that protocol for your patient, and when they're outside that parameter.
So it's either mass production of healthcare, standardized, one solution fits all, and 20% of the population will be above or under that definition, versus healthcare where the doctor is customizing to your particular need,
Yep.
which allows you to have a higher quality of life.
Yep. And I'll tell you right now, Lee, if I didn't have a team of doctors that worked one-on-one to customize my health care for me, I wouldn't be alive today.
When your many friends, doctors, that you developed relationship over the years because of your life situation, what do you think they are thinking about these days, and the young generation of doctors coming, where if we don't change direction, they're going to see a whole different occupation compared to what they've been trained to do and what probably motivated them for all that study to be someone that can heal and restore people. Now it's going to be different under Obama healthcare.
It's going to be completely different, and I think the difficulty is you're going to have a new generation of the best and the brightest in our colleges and universities across America that are going to look at going into a pre-programmed, limited scope medical practice, or being computer engineers, researchers, other ways to use that brain capacity that they've developed, and you won't have that best and brightest going into medicine. And that is truly what's scary. So I think when we look at it, the other concern then, and you deal with it up in the 7th District, there is a concern already with a shortage of healthcare providers in rural America. When that drops down, when that drops off, where can the people in the 7th District turn to when we've scared people out of medicine and there's already that shortage? It's frightening. It's frightening times ahead if we do not repeal Obamacare.